Here's a message from today's episode's sponsor.
Last year, nearly 40% of Americans delayed or skipped medical care due to costs. TaylorMed offers a comprehensive solution. The nation's largest network of patients, providers, pharmacies, life science companies, and other partners dedicated to improving healthcare affordability, anywhere a prescription is written or dispensed. TaylorMed's innovative product suite empowers network constituents to improve patient experience and outcomes while boosting their own financial health. Its best-in-class platform proactively identifies patients in need and automates enrollment in cost-saving resources spanning more than 60,000 assistance programs and over 1,000 chronic conditions. By matching patients with the right resources at the right time, TaylorMed enables pharmacies and providers to reduce prescription abandonment, boost adherence, and increase revenue. To learn more, head to www.taylormed.co.
You're listening to the Pharmacy Podcast Network.
This is the Sex PharmD podcast with your host, Dr. Nadia Archambault, licensed clinical pharmacist and certified sex therapist. With a focus on women's sexual health and wellness, Dr. A is here to cover important health topics and answer all of your questions about subjects that can be applied to pharmacy practice. And now, here's Dr. A.
Hello and welcome back to another episode of Pharmacy Podcast Network, Sex PharmD. Today, I have another fellow pharmacist who specializes in the field of sexual health, Dr. Tara Thompson. Welcome today.
Hi, thank you so much for having me. Glad to be here.
Yeah, I'm great. I'm so grateful that you were able to come on here. I know you're super busy. So Tara here is a pharmacist. She's a patient advocate in the field of sexual health. She's also a practicing compounding pharmacist for about 11 years now. Is that correct?
Yeah.
About 11 years? Yeah, that's great.
Yeah, 11 years. Wow.
Yeah. And she's at Innovation Compounding. And what I love about this is the compounding she does is in the field of sexual medicine. She develops and designs pharmaceutical drug combinations for various sexual health conditions, which we're going to talk about in the show. Also the creator of the website, thesexualhealthpharmacist.com, which we will be providing in the show notes. This is a phenomenal website. I love it. And creator of the advocacy panel called Just Ask. So we'll be talking about that too. I'm very excited.
All right. Yes. Oh, that's all my favorite things that you just talked about. So
yeah.
Thank you for saying that. Yeah. So nice to meet you all. My name is Tara Thompson. And so, yeah, I mean, basically right out of pharmacy school, I got a position in compounding. I actually trained down in Houston at PCCA, which is a big compounding company for those of you who know PCCA. But so I've always loved compounding. I was always very strong in chemistry and math. I get it. It comes to me really easy. So compounding worked out really, really well as a pharmacist because you get to do a lot of that chemistry and a lot of that math. So yeah, I got into compounding right out of pharmacy school, and I've really been here ever since. I joke that I probably won't ever do any other job besides compounding, but it's kind of true because I don't see myself anywhere else. So compounding sort of has brought me into this world of sexual medicine that I didn't even know existed. I know a lot of people listening are probably pharmacists, and we don't learn this in school. I mean, Nadia, did you learn sexual health? I mean, besides like maybe some men's health, erectile dysfunction, maybe
no,
some
nothing.
birth control, but
erectile dysfunction and birth control, and that was it. That's basically it.
Sexually transmitted infections. We learned about those.
Infectious disease included that, but nothing about this, you know?
Yeah. And I didn't even know, I mean, that it existed until I got into this compounding world. And we made a lot of hormone replacement therapy type compounds because that there's not a whole lot available at your retail pharmacy for hormone replacement therapy. So we did a lot of that. But what I was noticing is all these patients were also asking, and all these doctors too were asking about, well, what can I do with my patient with vulvodynia? What can I do for my patient with anorgasmia or clitoridynia or bacterial vaginosis? And so I was getting all these questions, and I was like, felt dumb as a pharmacist. I was like, I don't know, I'll have to look that up for you. So I got into this realm of just all of these amazing health conditions that I didn't even know existed. We weren't taught them in school. There is a entire population of patients who suffer from women's health, female sexual dysfunctions, pelvic pain issues, that they don't have anything available to them in the retail sector, in the commercially available FDA approved medications. And so these poor doctors and poor patients are reaching out and trying to grasp at how can I help my patient? What can we do? And so for me, it just opened my eyes to, wow, there's so much more out there that we, left to be studied. And that was 11 years ago. So I started just researching. I got involved in different organizations that supported women's health issues or pelvic health issues, and really met a lot of amazing providers, amazing healthcare providers, mid-level practitioners, doctors, nurses, pelvic floor therapists, met so many amazing people who are just like, oh yeah, there's an entire patient population out there, and we need to figure out how to help them. And so, yeah, that's kind of where my journey started. And I just got more in depth and tried to learn more about each one of these different health conditions, and then designing compounded medications and preparations around those disease states based on what was going on with the patient, what the mechanism of action of the drug did to help combat their particular etiology of their disease. So yeah, and then here we are today trying to advocate for patients to ask their healthcare providers about these things. I mean, so many women today think that, vaginal pain is normal and that they need to just suck it up and sweep it under the rug. And so many times we hear, people say, just have a glass of wine and some lube and it'll correct your problems. And it's like, no, this is actual, this could be of neurologic origin. This could be of hormonal origin. This is an actual ICD-10 code that doctors write for, but don't have therapies to help manage them. So
I know.
When
is it okay for pain to be okay?
Right.
I don't understand that.
Yeah.
I don't understand it,
Right.
Yeah.
So that kind of led me down the path of building the sexual health pharmacist. I try to just mainly advocate for the patient. I try to just get the word out about different medications that can help with, pelvic floor dysfunction or, post-operative therapies that may have affected some nerves in a patient after their hysterectomy, and what neuroproliferative conditions have arisen because of that, and what drugs can combat that. And sometimes it's not necessarily commercially available products. It might be, a lot of doctors prescribe oral gabapentin or oral amitriptyline for vaginal pain. But there's actually different medications that we can also build that are topical. We can build topical gabapentins, topical amitriptylines, vaginal suppositories like diazepam that help relax the pelvic floor muscles. There's just so many amazing different options out there that I feel like pharmacists are in such a great position to know, because we know those mechanisms of action and how they can help the patient. So
Yeah. Now, so as far as for our listeners, how can they find out about these different treatment options? As far as the compounds go, how did you find the ideas and find the compounds, as far as on a
Mhm.
research level, what's been the best practice for you?
The best practice for me, I would say, would be researching the disease state. Once you know what's causing, say it's pelvic floor muscle dysfunction, or what they also call vaginismus or levator ani syndrome. It's where the muscles of your pelvic floor basically are super tense. It's cutting off circulation to your nerves, causing vaginal pain in the vaginal canal and in that area. So the goal is to relax that muscle system that's there, the levator ani system of muscles. It's several muscles that hold up all of your organs and on your pelvic floor. So knowing how to relax that, and I think of it in terms of medication. There's other ways. There's pelvic floor physical therapy. There's certain like biofeedback techniques. But I think in terms of medication, what could I put anatomically at that muscle to help it relax? We've used diazepam, amitriptyline, cyclobenzaprine, baclofen. Maybe it's spasming. So building compounds around that just by knowing what's causing the particular condition. So I think the first step for me would be to research the actual condition itself, figure out what's causing it, and then knowing from a pharmacological standpoint, knowing what to use there to treat it. And there's a lot of ongoing studies that are testing a lot of these things. So you can find literature. Sometimes you have to extrapolate from different studies, different drugs from different studies. But I think that's where I got a lot. I also talking, with specific healthcare providers that are in this area of medicine. I mean, there's a lot of your urologists and gynecologists are seeing a lot of these types of patients too. So they're sort of educating themselves. They don't learn this stuff in med school either. So we're not alone as pharmacists. Nobody's teaching this. And so I think one of the problems is we need more curriculum around this, which is another, soapbox that we can tackle. But, getting advice from them too, like what could we use working together as a multidisciplinary team for a patient and figuring out what we can put together for this patient to help them, basically. Is the best.
I like that. It's patient centric. Yeah, I like how you approach that. That's great.
Right.
Yeah, and I've looked at the compounding company that you're with, and we'll include that in the notes also. And I love your website. And for our listeners also, you have some great under education. You have some great resources for organizations and associations. I know ASECT. I love ASECT, the American Association of Sexual Educators, Counselors, and Therapists. There's a lot on here too. There's just a lot to find, but it's just a matter of where to find it,
right.
because there's so many new things out.
Right.
Yeah.
I think one of the coolest, or one of the best organizations for me, where I've probably learned the most is ISWSH. It's ISSWSH, but it's the International Society for the Study of Women's Sexual Health. And so literally this entire organization is built around researching women's sexual health and all of these conditions. And it is just an amazing group of brilliant healthcare providers who this is their sole focus. This is what their entire practice is built around. And so they know a lot. And just getting involved as a pharmacist. I mean, they love pharmacists. They're like, ooh, tell me the dosing of this. Like, oh, what does this drug interact with? So they're always looking for help from pharmacists, and they appreciate our feedback and our creativity too. And we're like, have you tried this? Or like, what about this? And it's really interesting. We just put out a website called prosayla.com, prosayla.com. And we can tag all this at the end and everything, but it's kind of a patient like audience website where they try to go into each one of the different sexual health conditions and explain it like in a very clinical way and in a very way that you can trust this website because it's written by doctors. And so it's not like you're just Googling like, you know, what is that on my vulva? You're actually looking at a vulvar skin disorder, and this is written by doctors. It's telling you all the dermatoses that are affecting the vulva, what's causing the itching and burning and discomfort. So just a really great website we built. We started building it last year, and we're always adding new articles. So it's just a great resource for patients to go to and read about something, you know, from a medical standpoint and know that it's the truth and it's good information.
Yeah, absolutely. No, that's really good to know. Now, as far as compounds that you've seen and you've created, what are you seeing right now as far as ones for low libido? Anything for low libido for women? I know, you know, you talked a little bit about compounds used topically for women with pain during intercourse, which I think that's fantastic. You know, I think a lot of us pharmacists don't even know that that's out there, you know?
Right. Yeah, so low libido, otherwise known as hypoactive sexual desire disorder, HSDD, is the true ICD-10 code. That is, oh gosh, I just love this question. Okay, so it's so dependent on so many things. So in the sexual health field, we go a lot by what's called the biopsychosocial approach to low libido. And so that means that there's basically all these concentric circles. If you think about like a Venn diagram, there's like a biologic component. So that could mean it could be due to hormones, anatomy, you know, just whatever's happening biologically. Maybe you have some nerve damage, or maybe you just had a baby or something. So what's causing this low libido? And then there's the psycho. So the psychoanalytical part of what could be causing the low libido. Is it a body image disorder? Do you have some past trauma that's causing, you know, you to think a certain way? Were you raised a certain way where you were taught that was bad or a sin? You know, like there's that. And then there's the social aspect of it. So, you know, is it a religion thing? Is it, you know, there's just so many different factors that play into it. Is it a marital issue? You know, you have you have sexual therapists out there like yourself, but you have sexual educators who are just teaching patients that, you know, there's so much more to what's causing this. And it could be a multifactorial issue. Like there could be several different things. But a lot of it too could be, well, from a pharmacist standpoint, we look at it in the neurotransmitter sort of area. So there are 2 commercially available medications out there for low libido. They help balance your neurotransmitters out to where you have excitatory neurotransmitters and you have inhibitory neurotransmitters. And so these drugs are aimed at increasing your excitatory neurotransmitters, like melanocortin and epinephrine and those types of things.
Oh yeah.
And then you have your inhibitory ones that these drugs are also targeted toward those. So it's trying to get an imbalance, or it's trying to get a balance there, sort of increasing those inhibitory and decreasing the inhibitory and increasing the excitatory neurotransmitters. But those are commercially available, but those don't always work for everyone. So you might not have an issue with your neurotransmitters. It could be a hormonal issue, in which case we've used like testosterone helps with libido. Oxytocin helps with arousal that may be causing low libido if you're just like having a hard time getting aroused, which can be used for men and women, by the way. So
yes. I was involved with compounding with that also. That was pretty popular for both.
Definitely. It's a very, very popular peptide if you're looking to help with, it's called the cuddle hormone. So it's kind of layman term, the cuddle hormone. So it can be used for men and women. And it helps, sort of increase that arousal feeling and that feeling of being loved. It's a very calming, nurturing feeling from oxytocin. So those are some of the compounds that we do, is like oxytocin nasal spray, troches, sublingual troches or buccal lozenges. And then on the testosterone side, testosterone is only 3% bioavailable when it's given orally. So we usually never give testosterone orally. It's always usually topical or vaginal for women. You can also give it by injection, but it's a whole, there's a whole another piece to that because it's an oil-based product. But anyways.
Yeah. And it's such a tiny dose too. For women, it's
for
hard.
Women,
Yeah.
For sure.
Yeah.
Because women are 10 times less the dose of a man, or 10 times less the levels of a man. So you have to be careful with that. But usually compounding testosterone for women in terms of a vaginal or like a clitoral cream or oil that they can apply. And it helps just, cause a little bit more arousal, a little bit more libido there for them. So those are the two main ones I see compounded.
And it amazes me too, because I know whenever I look at patient, I'll tell, one of my female patients to get their hormones checked, and they'll come back and there's no testosterone in the panel. Like they just, I don't know why they always omit that. And testosterone is important for women. I noticed that a lot. I don't really understand why it's not always included in blood work panels.
Right. Testosterone is very, very important for women. Although we have very, very, minuscule amounts compared to men. People always think men, in terms of all this testosterone, like testosterone in the 800s and 900s and thousands. Well, women are in the like 10s and 20s and 30s. So it's just a very much lesser amount of testosterone needed for women, but it's still very important for libido and also for energy. So a lot of like postmenopausal women too, you'll see a zero testosterone in their system and they're just, run down, no libido. And it is a good medication when given in the correct dosing for women who need it, for sure.
Correct. Absolutely.
And so then there's another piece of female sexual health is vulvar and vaginal skin disorders. There's a whole realm of gynecologic dermatology. There's people who specialize in that field. This can be anything from the lichens conditions like lichen simplex, lichen sclerosis. These can happen in the vaginal area, in the vulvar area, which the vulva and the vestibule are just kind of the outer part of the vaginal area of a woman. So that's another important counseling point for patients to really show them a picture of the anatomy and say, this is where you're going to apply the cream. It's not just insert vaginally. Sometimes it's in a specific area. You use sort of like a clockwork technique at 12 o'clock, at 3 o'clock, at 6 o'clock, and you can teach patients that way. But there are skin disorders that happen in patients that there are compounded medications for. It could be that they need a mast cell stabilizer because they have a lot of itching and atopic dermatitis type issues there. And I think that a common thing that happens that, we're trying to help doctors with too, is that they'll prescribe them something at the retail pharmacy that's meant to be used on the skin, like for acne or something.
Right.
So, but that cream wasn't necessarily built for the vaginal area, which is a lot more sensitive. It's more of a mucosal area. It's just not in a correct base to be used vaginally. And sometimes that can irritate the patient even more. These patients are already sensitive. So, putting on a medication that was designed for the skin, which, has a slightly basic pH, and then putting it into the vaginal area, the vaginal canal, which has a pH of 4 to 5. Sometimes that just, is more detrimental for the patient. So building compounds that are appropriately pH balanced with those particular ingredients in it that the patient needs is also a really, really great place that compounding can step in and help with vaginal and vulvar health issues.
That's a very good point. Very good point. Yeah.
Sure. You don't think about that though, right?
No.
Like, I guess when you're writing a prescription, it's just like, oh, you need clobetasol. Okay, well, I'll give you the clobetasol cream. It's really cheap. That's pharmacy. But that clobetasol was designed for the skin. Like
right.
the more tough outer, barrier skin that has a different pH. And so, yeah, it's just, we can put clobetasol in a cream or ointment or oil or, something that is pH, more acidic pH. It's made for that particular area. It doesn't have a lot of additives or ingredients that the patient may react to. Can make it preservative free, alcohol free, all of that. So yeah, compounding certainly has a wonderful place in female sexual health. Like I said, that's kind of where I started learning about female sexual health, is because all these doctors were looking for these things and I wasn't necessarily educated on what they were for. So
we'd like to thank our podcast sponsors for supporting our programs. Here's a quick message.
Keycentrix is a premier provider of business-enhancing technology for independent pharmacies. Their powerful solutions help specialty, retail, mail order, and direct-to-consumer pharmacies thrive. Use New Leaf Pharmacy Management software with the SendKey communication platform and FlexTrax point-of-sale system to run better, smarter, and faster while maintaining the highest quality patient and prescriber care. Gain faster prior authorizations, greater patient adherence, improved prescription accuracy, and better utilization of staff. All with a 24/7 help desk and Keycentrix University, an online training system that can be accessed from any device, anytime. Learn how Keycentrix can help your pharmacy by visiting keycentrix.com.
Yeah, and I feel like that's where the therapy is going to come from is the compound on the compounding level, because there's really not a lot out there from a retail perspective, commercially available perspective. And I think that there needs to be more resources for our pharmacists as far as how to point patients in the right direction for when they do need something compounded like that. That's very specific.
Right.
Yeah.
Right.
No, absolutely.
Yeah. And when, there's also, I've seen a lot of really great strides being taken though, in terms of getting more studies surrounding these health conditions, more training available for providers around these health conditions, getting pharmacists involved on, in the sexual therapy realm, in the sexual education, sexual counseling, helping, becoming more a part of a team with these doctors to help them figure out how to treat these patients. So I've seen great strides happen versus 10 years ago when it was all kind of, new and there wasn't any medications out there for libido. There was nothing available for women, really.
Right.
Another, again, just kind of don't talk about it type of thing. But as compared to today, when there's definitely a lot more resources and people are starting to get a little bit more privy to, I guess, speaking out about their bodies and really asking the questions to their doctors, like, is this normal? Like, should I be experiencing this? And is there anything you can do for it? So
yeah, no, I mean, yeah, we have come a long way, at least. There's that.
Yes, but there's still a long way to go.
I know, it's true. Are you seeing compounding for in transgender medicine? Are you seeing anything coming through on that end?
Absolutely. So again, there's not, FDA approved treatments for these. So a lot of these providers are coming to compounders and saying, how can you help? Do you have any protocols available? Do you have, what dose do I give, this trans woman or this trans man who's, looking for to go through that change and you're manipulating their hormones essentially in those patients who choose to go down that route. And a lot of these providers who are seeing people with the sexual health concerns and conditions, they do get the transgender population as their patient population too, because it's kind of, they're kind of patient seeking help that they can't really find it anywhere else.
Right.
Because a lot of doctors are like, I have no idea how to navigate a patient who wants to, like a trans man who wants to get estrogen therapy, or testosterone therapy. So yeah, we are building a lot of protocols around that. There's a lot of great resources out there. A lot of it does center around hormone replacement therapy. So you're looking at, the estrogens and testosterone, and just balancing that out.
And I would imagine you have to work very closely with the prescribers, because it is really like navigating new territory.
Right.
As far as,
especially patients who undergo bottom surgery. So they're actually getting the surgery that goes along with it. Mm-hmm. You have the post-surgical care that goes along with that. And then also keeping that area healthy via the use of a lot of different medications and creams and things that are, adding hormones to the area too. So that's another thing to think about, is the post-surgical care that goes into it. And
yes,
most of the time involves hormone replacement therapy, and also some like pelvic pain remedies too. So,
and definitely. Now, as far as, are you dealing with mostly local doctors, or do you ship out of state at your pharmacy?
Yeah, well, Innovation Compounding itself is a nationwide shipping pharmacy. So they're licensed in 49 states, so everywhere except Hawaii. Mm-hmm. I volunteered to be the one to go get the Hawaii license, but there are some great compounders in Hawaii, so they kind of have a great monopoly over there. But so Innovation itself, if you're a compounding pharmacy, you have to be licensed individually in the states that you ship into. You cannot ship into a state that you're not licensed in.
Right.
So a lot of pharmacies are only licensed in the state that they're located in. Some pharmacies are licensed in, a couple of different states. The cool thing about Innovation Compounding is that they're licensed in all 49 states, or all the, contiguous United States and Alaska. So we can work with providers nationwide. And I think that's been very helpful, because we do have a lot of great information on sexual medicine. And so providers do really lean on that, and we can service their patients basically anywhere.
That's great. That's really good to know for our listeners too. If they're looking to refer, if they have patients they want to refer for compounding, that's really good to know. Absolutely. Because it's hard to find, depending on what state you're in.
It is hard to find. I always encourage people to join these, especially pharmacists. I'm always advocating for pharmacists to be involved, but to join some of these organizations too, like ISHWISH, like OGS, the American Urogyne Society. They're a wonderful society. They have brilliant minds. They're doing sexual medicine too. And just to come in as a pharmacist and stand up for yourself and say, hey, we can make these things. We can help your patients. Here's what we have. Here's how we can step in and fill that gap and increase your patients' access to the medications they need. So I'm always encouraging that too. But I mean, sure, Innovation will take your prescriptions if you want to.
Yeah. No, I think it's great. Yeah. And I love that. I love your Instagram too. Where did you find the pink banana photo for your website? I love it.
Oh my gosh. Fantastic. One of our amazing marketers at Innovation helped me get that scheme together. So
I love it.
She's a wonderful designer.
That is great.
I know it's kind of provocative, but I'm like, you know what?
No, it's good.
It gets you looking, and you're like, okay, all right.
Mm-hmm. No, I love it. I love it. So tell me about Just Ask. And I will say this is so funny. So my LLC is Ask. It's called ASK Pharmacy Professionals. And my little tagline for a while was Just Ask.
Wow, that is funny.
Yeah, I just use it for my LLC, but I thought that was so funny when I saw that. I was like, yeah, right on. Okay.
All right. Yeah. So Just Ask is basically my little passion project. So I have a dear friend and colleague that I met through sexual medicine. Actually, her name's Heather Quayle. She's a nurse practitioner. She's a fantastic individual, and she's always advocating for patients to just ask their most embarrassing, taboo, mythical questions that they are too scared to ask anyone. And so we basically made this podcast with that being our platform, and it's patient focused. So we kind of talk in layman's terms down to the patient, just saying not down to the patient, but in patient's terms, so that they can understand these are we bring on a sexual health expert. So it might be a urologist or a gynecologist, a pelvic floor therapist. We've even had like a sexual assault survivor and nurse examiners. And so basically we're just sort of like walking patients through different health conditions, different questions that they could be asking their doctors, and kind of just encouraging them to just ask those questions to their doctors and letting them know that they're in a safe space. It's something that you'd be really surprised to know that once you start talking about this or looking for answers, there's a lot of information out there. And chances are that your provider, your healthcare provider that you're seeing has heard this before, or they have seen this before and probably know how to either treat you or at least get you in the right direction and on the right path to doing something about it. So I think part of it is just the stigma around asking the questions. And that's what we're trying to sort of break down. So yeah, it's just a podcast we do. It's once a month. And Heather and I just co-host it, and we bring on someone and just have like a very casual conversation like today, and just ask that provider questions, like walk us through a patient, exam that you would do, or what questions do you ask? Do you ask permission? Do you get consent? Do you, what? And so that way, I don't know, it's just a way for patients to hear. I think the more information, the better, and the more education that they can go into their appointment, or, they're hearing from healthcare professionals instead of Googling it, the better for them. So that's kind of why we did that. And it's been really, really great. We've gotten a lot of really wonderful people there that have come on the show as guests and just open our eyes to even different health conditions that we didn't know about. And men's sexual health too. I mean, we're not excluding the guys here. I mean, there is certainly lots of sexual health conditions that happen in men. A lot of them have treatments available, but a lot of them don't. So there's a whole other realm too that we can save for another show.
Oh, I know, right? I mean, there really are so many things that come up. And, I know going back to the compounding end of things, with the patient-centric approach, the female sex organ is the brain. It starts there. So there's a lot going on,
Absolutely.
and things that can affect the sex drive, or, someone that even has vaginismus, for example, it might be more of a mental thing. There might be something else going on with trauma that's causing the muscles to tense up. It's really, it makes it more complex to treat the female patient for sure.
Right. There's, I think the first step of learning or knowing how to treat or what therapy to use is to have a proper diagnosis by the healthcare provider. So, I mean, to figure out where it's coming from. Is it apprehension because, you're scared, or does it literally hurt? And if it hurts, then at what point? Is it at, first penetration? Is it a deep pelvic pain? Like what is causing this? And could it be a deeper issue? Could there be, I don't know, fibroids there or tumor, like you have to go through all of the steps. And there is some really, I mean, that's where the research is getting better and better. And there are some protocols available for providers to actually, diagnose these things properly, and then going from there on how to treat. There's different steps. There's like for instance, vulvodynia and vestibulodynia, which is basically pain on the outer vestibule of the vagina, not necessarily inside, but it's on the outer portion. And then the vulva are the lips, the labias. There's pain associated with that, and it can be of different origins. It could be neuropathic, so it could be nerve pain, or it can be hormonal pain due to like low estrogen in the area can cause a thinning of the mucosa there, which can cause pain. It could be upon penetration. It can be just, sitting down for no reason. There's different origins of this pain that has to first be properly diagnosed, because then you can get a very more targeted treatment plan.
Yes.
There's inflammatory vestibulodynia that could be caused by an outer, issue of, what's something else that's causing the inflammation there. So just so many different causes, and that is all very well spelled out in the guidelines too, is the different causes and where the delineations are between that, and then where to go from there as far as treatment.
Yeah, that's a very good point. As far as where to start, right. With the treatment plan.
Sometimes these are present since birth. It's something they're born with, and then sometimes it can be due to a surgery that happened, and then it started after that. It could be there's so many different reasons, and then going back to the biopsychosocial approach, there's always that you have to think of too. Is there other issues that are going on that also have to be treated concentrically so that everything gets taken care of?
Yeah, absolutely.
Yes. Such an amazing field.
Yeah, I know. I love that. Well, there's so much to learn, So for our listeners who don't know anything about even some of the things you were talking about, they're like, I've never heard of this or that, where should they start as far as educating themselves? I know there's, it's hard to figure out what website to go on. But where should they start as far as some websites or resources that have the best content for them to educate themselves?
Yeah, I think that the one I mentioned before, prosela.com, that is my favorite because it's connected to ISWISH and it's written by actual, medical professionals that specialize in this. So they're literally the best fountain of information that you can find. And that is prosayla.com. My website it's okay. I mean, it'll have some links.
No, your website's great. Yeah.
It doesn't have a lot of, I don't go into depth about each, disease state or health condition, but it does have some good resources and links that can take you places that I know are trusted. And so sometimes I send patients there and I'm like, oh, you need a place to go for premenstrual syndrome or premenstrural dysmorphic disorder. I have a website for that is vetted out and legitimate. So
I think it's great. I think it's really great, at least as a starting point. They can go on your resources page. I love ISWISH also. I think they're great, and people can kind of go from there as far as navigating. But yeah, you have some great resources on here that make it easy, like a one stop at least to start.
And there's so many wonderful, I hate to say social media is the place to go, but there's so many wonderful doctors, providers, nurse practitioners, therapists, pelvic floor therapists. There's so many great people on Instagram. I've learned so much from there are actual urologists who will go on there and, talk about a patient case or, do a highlight, all week, we're going to talk about DHEA and everything, all the great things that DHEA does. And these are coming from doctors. I mean, these are they see this day in, day out, and pharmacists too. And I try to put some stuff on mine, to sort of, highlight important articles that I see that have to do with sexual health or certain medications that are used in the field, and sort of highlighting the important points about those medications. So, I mean, you can find a lot of great stuff. You can find a lot of iffy stuff too, but if you follow the right providers, then it really is a great
absolutely
information.
Yeah, no, this is great. Well, what I like to ask always on my shows, or I do a top 3. So what would be your top 3 compounds that you see that maybe, and it can be anything. It can be ones that you've seen as most effective or the most popular in your practice and we'll just be specific with the woman's sexual health.
Okay. I think probably my favorite that I've seen just the most positive outcomes, optimal outcomes as a result is vaginal diazepam suppositories.
Okay.
There's nothing like that out on the commercially available market. No. It's almost an immediate relaxation of the pelvic floor muscles, the levator anti-system of muscles. And there's different doses you can do. People are more sensitive than others. Some people need a larger dose than others. They can be used, PRN sometimes. They can be used once a day, twice a day. And it doesn't give the same. I always have students who are like, why would you do Valium? Isn't that for anxiety, or like, doesn't that make you tired? And I'm like, well, when you take it orally, drugs do different things when they're given in different routes of administration, right? So orally, yes, it is FDA approved for anxiety. You take it by mouth, it can make you sleepy, it can calm you down. But it's also it's a benzodiazepine, right? It binds to the GABA receptor. It's a very down-regulating drug. And when it's put right directly on the muscle or very close proximity to the muscles, you get that relaxation of muscles. It gets into those muscles, binds to the GABA receptors, really just kind of helps relax the whole thing. But it doesn't give you a whole lot of those side effects. Yeah, there's always a chance you can get some sleepiness or whatnot, but it's not working via that mechanism of action. It's not going through the same metabolism as it would had you taken it orally.
Right,
so
exactly. Yeah.
That drug is cool. I just like it because I've seen it work in action like so wonderfully and just be so relied upon.
And I bet a lot of our listeners haven't even heard of that. Really,
yeah, it's my favorite just because I just know the wonderful, outcomes that it has proved for so many people. And that's just, field experience for me. There are some pretty good studies though. What else? Oh my gosh. Probably boric acid for bacterial vaginosis.
Yes.
Vaginal boric acid. I just love the mechanism of action from a nerd standpoint. So basically, boric acid goes in and punches holes in the bacterial cell wall, which we all know bacterial cell walls can be very hard to penetrate sometimes with antibiotics, especially resistant bacteria or recurrent bacteria, recurrent BV or resistant BV. So boric acid basically goes in and punches holes. You have to use it vaginally. You cannot take it orally. It's toxic.
Oh yeah, no, do not take it orally.
No. Yeah. Vaginal boric acid punches holes in this bacterial cell wall. And then you can use like your metronidazoles and your nystatins and that kind of thing to allow the drug to penetrate the core of the bacteria. So I just love that because I just think it's cool. It works very synergistically with antibiotics and antifungals and anti-yeast medicine. So
no, that sounds like very beneficial for women for sure.
For sure. Yeah. For sure. And it's not that well known is the thing.
It's not. And it's old school. Like boric acid's been around for a long time, you know?
It's old school.
Yeah.
School. And doctors are like, oh, I've been giving her, vaginal metronidazole and it's not working anymore. And I'm just thinking like, oh my gosh, those bacteria in there are just like having a party. Metronidazole not doing anything. But that's where, as pharmacists, we can step in and say, like, have you tried it in tandem with boric acid? Boric acid actually punches holes in the cell wall. It also messes with the pH a little bit, so it kills off a lot of that bacteria. They can't survive in a super acidic environment, so it'll kill them. So boric acid's cool. And then, oh my gosh, I don't even know. My third one would probably have to be. I'm gonna go with testosterone. I'm gonna go with the trusty testosterone for women because I just don't think it gets enough. It doesn't get enough kudos as it should as a medication for women. It flies under the radar. It gets all of its glory for men, but it has a very, very important place in women's health. And we don't see it that often. We don't see it FDA approved for women. So I think that's where
I know.
It's kind of like a secret tool.
Yeah. No, that's great. Those all sound really good. I think one that I've seen a lot in practice would be the oxytocin also. The nasal spray was really popular.
Oh, for sure. Mm-hmm. Oxytocin is so neat. And even like educating people about it, and they're like, ooh, oxytocin, like, what are you trying to do? Put my patient in labor? And I'm like,
I know. Everyone thinks that, right?
Well, not really at that dose. It's a much lower dose. It's a very much lower dose. But yeah, just oxytocin's a good one, the cuddle hormone.
Yes, I love that. That's great.
I love it.
Well, I feel like we could be talking about this for another hour or so. This has been really, really great. And I've learned some things also. I mean, there's so much to learn.
Good.
As far as I'd love to have you back on again to talk about, maybe we can talk about the men's health and maybe some new things that come out.
Sure.
That would be great. Yeah.
I love that.
As far as where to find you, what are the best? So the sexualhealthpharmacist.com is your website.
Yep, that is my website, thesexualhealthpharmacist.com. I'm more active, I would say, on Instagram. So I try to put, the latest and greatest information there. And that is the same handle. It's at the sexual health pharmacist, just like it sounds, one word. I try to put as I see articles come out. I just did one on Alzheimer's and hormones and how, hormones. Yeah. So just interesting things that are going on. I try to include men's sexual health there too. So you'll see some of those pop up sometimes. And every now and then I'll go over a different drug that's used for sexual health. And then of course I'll post my Just Ask podcast episodes once a month as they sort of release out. So you can kind of stay, if you're interested in hearing from different specialties in the sexual health field, then that's on there too. So I'd say Instagram probably the most.
Yeah, I love your Instagram. That's great. And your website really is fantastic. So
it's been a fun passion project for sure.
Yeah. Well, great. It was so great having you on, and looking forward to hearing and reading more on your website and seeing what else that you're doing. It's really great, and it's so important, and so it's very rare. It's a very rare thing that I see now. So I think it's great what you're doing.
Well, thank you. I appreciate giving allowing this platform to just further spread the word and spread the advocacy for that, and in a field that needs it so much. And I think the next project that we need to all probably join forces on is getting into some of the pharmacy school curriculums and really teaching the source instead of having to learn it on our own afterwards.
Yeah, no, this definitely needed.
For sure.
Well, great. Well, thank you so much, Tara, and I'm looking forward to talking to you again.
You too. Thank you so much for having me.